Alright, so we'll quickly be talking about another test, alright, which is used for diagnosis of diabetes mellitus. So this test is what is known as a glycated hemoglobin test. Alright, so glycated hemoglobin test is a very simple test and it's like a golden standard for diagnosis of um diabetes mellitus. Like if they ask you like single-handedly what is the best test for diagnosis of diabetes mellitus, it's a glycated hemoglobin, right? So it's also abbreviated as what? Hemoglobin A1c or HbA1c. So the basis of this test is just like, okay, in diabetes mellitus you have what? Excess glucose in the body. So there's excess glucose to the level that's what? Glucose is now binding to hemoglobin, right? Forming what is known as what? Glycohemoglobin. You understand? Or glycated hemoglobin. You understand? So the glycated hemoglobin test is also known as what? HA1C or A1C test, right? Or hemoglobin A1C, any way you want to call it, right? So it just measures the amount of glucose, right, over the past 2 to 3 months. Do you understand? So if it has the ability to measure even backward, do you understand? So it's a gold standard for diagnosis of diabetes. So purpose of this test is to diagnose diabetes like type 1, type 2, monitor diabetes, assess the risks for the diabetes, right? So how does it work? Now, basically, hemoglobin is a protein in red blood cells, so it carries oxygen. Now, glycation. Now, when glucose levels are so high, glucose attaches to the hemoglobin, forming what is known as what? Glycated hemoglobin. Alright. So measurement is the test is just trying to measure what the percentage of glycated hemoglobin that is in blood. Right. So result is if normal ranges should just be 5.7 or lower than 5.7. That's the amount of glucose that is binding to hemoglobin in a normal human being. Then when it's going towards diabetes is when it's approaching 6.4. Then anything 6.5 or higher, that's when you have diabetes, right? So interpretation is low levels, okay? Lower levels indicate that blood glucose is under control, while high levels indicate that there's a poor control of what? Blood glucose, right? So frequency with testing for individuals with diabetes, they should always do it 3 to 6 months. For individuals without diabetes, just based on the risk factors, right? So I think this is just it for glycated hemoglobin, see glycohemoglobin test. Right, so that's it.